The origins of the coronavirus. Coronaviruses were originally discovered in the 1960s. The earliest ones discovered were infectious bronchitis, virus in chickens, and 2 viruses from the nasal cavities of human patients with the common cold that was subsequently named human coronavirus 229E and human coronavirus OC43. Other members of this family have since been identified, including SARS-CoV in 2003, HCoV NL63 in 2004, HKU1 in 2005, MERS-CoV in 2012, and 2019 ncov. Most of these have been involved in serious respiratory tract infections. What is the coronavirus? Coronaviruses are a group of viruses that cause diseases in mammals and birds. In humans, the viruses cause respiratory infections, which are typically mild, including the common cold, but rare forms like SARS and MERS can be lethal. In cows and pigs, they may cause diarrhea, while in chickens they can cause an upper respiratory disease. There are no vaccines or antiviral drugs that are approved for prevention or treatment. A new strain of virus that appears to have originated in China in the city of Wuhan is spreading rapidly and crossing borders. There are more than 4,500 confirmed cases worldwide and 106 reported deaths as of January 28, 2020. What kind of disease is this? The outbreak is caused by a coronavirus. Common human coronaviruses cause mild to moderate upper respiratory symptoms, including the common cold or flu-like symptoms, which more severe types can cause pneumonia and death. The name for this kind of virus comes from the crown-like spikes it has on its surface. Corona is Latin for crown. This strain of the virus is called 2019 ncov for now, which is short for 2019 novel coronavirus. It is the only third strain of coronavirus known to frequently cause severe symptoms in humans. The other 2 are MERS, Middle East Respiratory Syndrome, and SARS, Severe Acute Respiratory Syndrome. Where did it come from? Coronaviruses originate in animals like camels, civets and bats, and are usually not transmissible to humans, but occasionally a coronavirus mutates and can pass from animals to humans and then from human to human, as was the case with the SARS epidemic in the early 2000s. SARS stands for Severe Acute Respiratory Syndrome. China's National Health Commission confirmed that 15 healthcare workers have become infected, indicating that the virus can spread from human to human. Most, but not all, of the first known cases in December 2019 were traced to an animal market in the Chinese city of Wuhan and are believed to have come from the contact with live animals that were infected. It is believed snakes, the Chinese crate and the Chinese cobra may be the original source of the newly discovered coronavirus that has triggered an outbreak of a deadly infectious respiratory illness in China this winter, has now been put into lockdown in order to try and halt its spread. The market in Wuhan has since been closed. Wuhan is a major logistics and transportation hub. It lies about 500 miles west of Shanghai and is home to more than 11 million people. Who is at risk of becoming infected? The World Health Organization Committee on the Coronavirus said in a 22nd January 2020 news conference that nearly 3/4 of cases have been in people over the age of 40 years old and in some cases who have died. Many had significant underlying conditions like cardiovascular disease and diabetes. However, there are confirmed cases in otherwise healthy young individuals. What are the symptoms? The virus causes fever as well as respiratory symptoms, dry cough, difficulty breathing. It can also cause diarrhea and body aches. Symptoms in severe cases include pneumonia, kidney failure, and even death, according to the World Health Organization. The incubation period of the coronavirus remains unknown. Some sources say it could be between 10 and 14 days before the virus is detected. What treatments are recommended for this virus? There are no virus-specific treatments for the 2019 novel coronavirus. The Centers for Disease Control and Prevention suggests supportive care to manage and relieve symptoms. There is no approved vaccine available for this virus. What are the affected countries and regions? To date, 18 countries or places have confirmed cases. Mainland China reported more than 4,500 cases as of 28th of January 2020, including 106 deaths. At least 76 other cases have been identified in 17 other places, including the United States, United Kingdom, Canada, Australia, France, Germany, Hong Kong, Japan, Macau, Malaysia, Nepal, Singapore, South Korea, Taiwan, Thailand and Vietnam. 5 US cases have been reported to date. The first US case was reported on the 21st of January 2020 in a man who travelled to China and began experiencing symptoms a few days after returning home to Seattle on the 15th of January 2020. The second case, a woman in Chicago, was confirmed 24th of January. 2 cases have been confirmed in California and 1 in Arizona. The coronavirus outbreak has sparked fears for a potential pandemic, with thousands of people infected by the illness. So has coronavirus reached the UK, and which countries have been affected by the virus? Today, the 31st of January 2020, 2 people in England have tested positive for the coronavirus in the UK's first confirmed cases of the deadly disease. However, there have also been confirmed cases across the world, including the US, Cambodia, Canada, Japan and Malaysia, among others. In Europe, 3 cases of coronavirus were confirmed in France over the weekend. A case of the virus was also confirmed in Germany this week in southern Bavaria. The United Arab Emirates Ministry of Health and Prevention reported 4 cases of the viral infection in the United Arab Emirates pertaining to 4 Chinese family members that had recently made their way to the country from Wuhan city. The first case of coronavirus was diagnosed in Chinese citizens from Wuhan city, China. The Ministry of Health and Prevention announced in a tweet. Meanwhile, the health condition of those infected is stable and under medical observation. The China outbreak. The National Health Commission presented China's strong public health capacities and resources to respond and manage respiratory disease outbreaks. The discussion focused on continued collaboration on containment measures in Wuhan, public health measures in other cities and provinces, conducting further studies on the severity and transmissibility of the virus, continuing to share data, and for China to share biological material with the World Health Organization. These measures will advance scientific understanding of the virus and contribute to the development of medical countermeasures such as vaccines and treatments. How does it spread? The health officials believe the virus can be passed from person to person via exchange of fluids from the respiratory tract, but they still don't know precisely how. The respiratory route seems likely because the clusters of cases have been observed within families whose members have had prolonged close contact with an infected person. There is emerging evidence in Wuhan that the virus can spread from one person to another multiple times, the way that a disease like the flu spreads. That is something that global health officials are watching for in international cases. How serious is this? This virus is highly infectious, according to China's Bureau of Disease Prevention and Control. However, the agency does not consider the disease to be as virulent as the one that caused the SARS outbreak in 2003. The risk to the general American public is low, according to the Centers for Disease Control and Prevention. Most cases have been found in China, and so far, international spread seems limited. What is being done to contain the spread of the outbreak? Government officials in China have temporarily shut down transportation to and from Wuhan by bus, subway, ferry, airplane and train, according to Chinese state media. At least 12 other Chinese cities have limited travel as well. The travel ban came just days before the biggest holiday on the Chinese calendar, the Lunar New Year. Hundreds of millions of people travel every year during this holiday season, starting on the 25th of January and extending into February. Airports around the world, including 5 in the US, have implemented screening procedures for passengers arriving from affected areas. On the 28th of January, the United States announced a total of 20 airports will begin screening passengers from China. On the 27th of January, The Centers for Disease Control and Prevention and the United States State Department recommended that travelers avoid all non-essential travel to China.
Let's get right to our top story, the expanding outbreak of the deadly coronavirus. Look at the map. What started in China has now spread to Europe, Australia, and the United States.
Here's what we know as we come on the air. There is now one more confirmed case in the U.S., bringing the total to 3. In China, where the outbreak started, the total number of those sickened rose overnight to 2,056 people have died.
And we can now confirm that the U.S. State Department is evacuating staff from the consulate in Wuhan, China. Ground zero for the outbreak. ABC's Ian Pannell is covering it all for us from Hong Kong. Ian, good morning to you.
That's right, lots to bring you up to date with. Growing numbers infected, a new warning about how contagious this could be, and the American family trapped in the middle of this crisis. This morning, another American diagnosed with a potentially deadly coronavirus. The patient in Southern California is the third to be diagnosed with the new pneumonia-like virus in the US. The Centers for Disease Control and Prevention confirming they'd been to the Chinese city of Wuhan, the epicenter of the outbreak, and tested positive for the virus overnight. The patient's in isolation and said to be in good condition, but officials warning more people will likely become infected. This as the outbreak escalates yet again. There are now 15 countries and territories worldwide with cases. This morning, Chinese health officials saying more than 2,000 are now infected there and 56 have died. The Chinese health commissioner now warning the source of the infection still unknown. The harmfulness of the coronavirus to people of different ages is now changing. And most worryingly, indications the virus is becoming increasingly contagious. Over 1,300 more medics have been flown to the epicenter Wuhan, where officials are scrambling to build 3 new emergency hospitals in a matter of days. These exclusive images, filmed for ABC News from inside the city, show a ghost town, with signs warning people to wear masks fluttering in the wind. Some shoppers take the risk to stock up on desperately needed supplies. But there are still around 1,000 US citizens stranded in the Wuhan area. Now the State Department is scrambling to evacuate some of them, but it appears so far the space to get people out is limited. We spoke to one American family trapped in a city over 200 miles from Wuhan. The Stockstills from Rhode Island were visiting family for the new year to introduce baby Maxwell to his grandparents when the infection broke out.
We're scared, and there's a little guilt involved from putting him in this situation, having him travel abroad at such a young age. There's a lot of guilt involved there.
Well, as you'd expect, Patrick and his wife Ping are desperate to get their kids out, but they're also afraid that even if space opens up on one of those Mercy missions, they won't be allowed to travel on the roads to get to the airport. Dan?
And Ian, a particularly worrisome development. Chinese officials are now saying this virus is infection even in its incubation period before any symptoms show.
Yeah, that's right, and that's likely to worry many. Remember the deadly SARS and Ebola outbreaks that killed hundreds in Asia and Africa. Well, in those cases, a person was only deemed infectious when those symptoms appeared. Now, scientists, this is just what the Chinese are saying, still needs to be verified. But the scientists in China are saying that people could be infectious without any symptoms. And of course, that could make it much harder to detect and control. Dan?
Yeah, very problematic if true. Ian Pannell, thank you very much.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.
Stopping the virus. Stopping the spread of the virus both in China and globally is the World Health Organization's highest priority, said Dr. Tedros. We appreciate the seriousness with which China is taking this outbreak, especially the commitment from top leadership and the transparency they have demonstrated, including sharing data and genetic sequence of the virus. The World Health Organization is working closely with the government on measures to understand the virus and limit transmission. The World Health Organization will keep working side by side with China and all other countries to protect health and keep people safe. A slew of multinational firms have already predicted a financial hit, while many have introduced emergency measures to ban staff from traveling to China and to quarantine those who have already done so. The fast food giant McDonald's shuts 300 restaurants in China as the coronavirus spreads. The fast food chain sets up Epidemic task force in response to the virus, which has killed 132 people and infected more than 6,000, particularly in Wuhan, the capital of the Hubei province. Apple said it had now factored disruption into its financial forecasts, given that it has multiple factories in China, which is also the world's largest smartphone market. The coffee chain Starbucks said it had been forced to close about half of its 4,100 shops in the country, signaling a significant hit to its revenue. Facebook has suspended non-essential travel to mainland China and told employees in China to work from home. HSBC, which is Europe's largest bank and has strong ties to China, has done the same. Standard Chartered and Goldman Sachs are among banks that have taken similar steps, while the South Korean electronics firm Samsung has told staff in Hubei to stay at home for 7 days. Airlines around the world have also called and cancelled flights to China, including British Airways, the US carrier United and Air Asia. Germany's Lufthansa said on Wednesday that its flagship carrier, as well as Swiss and Austrian airlines, would fly to China one last time before suspending operations until 9th of February. Lion Air and British Airways among airlines cancelling some or all flights to China after government issues warnings.
The coronavirus outbreak, which, as you can see, is spreading through the world, mainly China, but elsewhere in the world as well. It's not just a major health threat, it's also causing serious economic reverberations. Most obviously, share prices are down in Asia, in the US, and across Europe. So the FTSE down by 2.3% today, actually the biggest fall since October. Germany's DAX and France's CAC Caron also down by similar magnitudes. And while Chinese markets were closed for Lunar New Year, they were down 2.8% at the end of last week. Oil prices are also down. Brent crude down below $60 a barrel for the first time since October. Why? Well, in short, it's because even if this outbreak is pretty contained, it's still going to stop people travelling or trading. And in China, more than 50 million people have been prevented from travelling from the affected areas, which is a huge deal because Lunar New Year is usually a big time for travel and for spending. So you've got domestic implications. China, now the second biggest economy in the world, and any hit to growth is going to reverberate around the globe. Domestic spending actually accounted for 3.5 percentage points of total economic growth of 6.1% in 2019. So you've got the impact on Chinese tourism. So countries like Japan, Hong Kong, the luxury and travel sectors, they could be very much affected. You've got Chinese tourists who spent $130 billion overseas in 2018. And when you have a look at the stocks which are down, you can see there's a clear pattern. So you've got travel-related stocks like British Airways owner IAG down by 5.5%. Hotels Group Intercontinental, IHG, is also 4.9% lower. And in the luxury sector, Burberry down 4.8% and LVMH down 3.7%. Now, ratings agency Standard & Poor's says a global epidemic would impact investment, travel and tourism and industrial output, though some of the impact could be offset by increased government spending on health, emergency services and vaccines. How big could the eventual impact be? Well, the SARS outbreak in 2003 is estimated to have wiped $40 billion off world economic output. And it's too early to work out whether coronavirus could be more or less costly, but investors are clearly concerned.
Where can I get the latest information? The Centers for Disease Control and Prevention is maintaining a traveller's health notice. The World Health Organization has a website for outbreak news. The China Center for Disease Control and Prevention has an epidemic tracker. The public should continue to monitor your country's health ministry, updates and announcements. and follow the guidance of your local health authorities. What is the reality of the coronavirus? Are our governments withholding information regarding the coronavirus outbreak? The 2019 novel coronavirus infection rate is far greater than the projected figures mentioned by the media and the health officials. The real figure is anticipated to exceed the 100,000 infection rate mark. Some doctors and nurses in China have already confirmed the actual infection rate is currently nearing the 90,000 mark and rising. Unfortunately, the Chinese government and the international community are in denial and withholding this information. As a result, this is having a detrimental impact on the Chinese economy and international trade relations, where the stock markets are starting to plummet and trade relations are being hindered. The reality behind the coronavirus is that it is not a new invention or a new virus, but rather an evolved 7th generation supervirus or superbug that is designed to adapt, evolve and kill. We are already aware of 6 generations of the coronaviruses to date, with similar capacities to infect, transmit and kill. In addition, the coronaviruses are designed based on Agenda 2030. Its ultimate goal is depopulation of the world through infection and mortality. All the governments and institutions around the world have been preparing for this event and outbreak for decades, but have been withholding information from the public.
Both of those 2 meetings, he asked me if vaccines weren't a bad thing, because he was considering a commission to look into ill effects of vaccines, and somebody, his name is Robert Kennedy Jr., was advising him that vaccines were causing bad things, and I said, no, that's a dead end, that would be a bad thing, don't do that, and him that vaccines were causing bad things, and I said, no, that's a dead end, that would be a bad thing, don't do that.
First, we've got population. The world today has 6.8 billion people. That's headed up to about 9 billion. Now, if we do a really great job on new vaccines, healthcare, reproductive health services, we could lower that by perhaps 10 or 15%. Now, if we do a really great job on new vaccines, healthcare, reproductive health services, we could lower that by perhaps 10 or 15%. But there we see an increase.
The vaccines, what does that mean exactly?
Well, over this decade, we believe unbelievable progress can be made, both inventing new vaccines and making sure they get out to all the children who need them. We could cut the number of children who die every year from about 9 million to half of that if we have success on it. And the benefits there in terms of reducing sickness, reducing the population growth, it really allows the society a chance to take care of itself once you've made that intervention. The benefits there in terms of reducing sickness, reducing the population growth. Now there's a type of foreign assistance for vaccines or for AIDS treatment that are incredibly effective. These are all about saving lives. And the good news is that as you make those breakthroughs, the population growth in the country goes down. These are all about saving lives. The population growth in the country goes down.
Evil David Rockefeller on C-SPAN at the UN Ambassador Dinner.
It is the world population that has risen during the same short period of time geometrically to almost 6 billion people and could easily exceed 8 billion by the year 2020. The negative impact of population growth on all of our planetary ecosystems is becoming appallingly at dangerous levels. Unless nations will agree to work together to tackle these cross-border challenges posed by population growth, overconsumption of resources, and environmental degradation, the prospects for a decent life on our planet will be threatened. The recent UN meeting in Cairo is appropriately focused on one of these key issues, population growth. But the controversies which have erupted at the conference illustrate the problem of coming to grips with issues that are deeply divisive and which have a profound moral dimension. The United Nations can and should play an essential role in helping the world find a satisfactory way of stabilizing world population and stimulating economic development in a manner that is sensitive to.
Out of these troubled times, our fifth objective, a new world order, can emerge, a new era, freer from the threat of terror, stronger in the pursuit of justice, and more secure in the quest for peace. An era in which the nations of the world, East and West, North and South, can prosper and live in harmony. 100 generations have searched for this elusive path to peace, while 1,000 wars raged across the span of human endeavor. And today that new world is struggling to be born. A world quite different from the one we've known. A world where the rule of law supplants the rule of the jungle. A world in which nations recognize the shared responsibility for freedom and justice. A world where the strong respect the rights of the weak.
We have before us the opportunity to forge for ourselves and for future generations a new world order, a world where the rule of law, not the law of the jungle, governs the conduct of nations. When we are successful, and we will be, we have a real chance at this new world order, an order in which a credible United Nations can use its peacekeeping role to fulfill the promise and vision of the UN's founders.
What is at stake is more than one small country. It is a big idea, a new world order, where diverse nations are drawn together in common cause to achieve the universal aspirations of mankind: peace and security, freedom, and the rule of law. Such is a world worthy of our struggle and worthy of our children's future. Now we can see a new world coming into view. A world in which there is the very real prospect of a new world order. In the words of Winston Churchill, a world order in which the principles of justice and fair play protect the weak against the strong. A world where the United Nations, freed from Cold War stalemate, is poised to fulfill the historic
We have before us the opportunity to forge for ourselves and for future generations a new world order, a world where the rule of law, not the law of the jungle, governs the conduct of nations. When we are successful, and we will be, we have a real chance at this new world order, an order in which a credible United Nations can use its peacekeeping role to fulfill the promise and vision of the UN's founders.